Just checking. Got it. Thank you. So if you or your colleagues need to revisit this, today we're going to exclusively talk just about one topic. You've probably seen it in our newsletter. There's been some communications about it. There's even been some press on it too, and we're very, very excited with this collaboration with Guidehealth. So today we'll be talking about Guidehealth, what it's going to do and what it's not going to do, and how it's going to work. So I'll just begin framing the discussion, and you can see also next to me Dr. McKay Crowley, who will give a little bit of presentation from Guidehealth itself. But we knew at the clinical network that we needed to help you in your practices, and knowing how strapped you are on time and resources to reach out to your patients and to supplement the great care that you give at every visit, but before that visit, after that visit, and between visits, to make sure that we can help you with that lift in patient outreach, especially on the more complex patients there. We have this in mind first and predominantly for the ACO, but this will extend to all. We envision this growing into the other areas that you also involved with the PA Clinical Network, but first and foremost with the ACO and this audience today with that. Some of you have already been directly contacted, and I appreciate your cooperation, and you've been very helpful. The rest of you also will be contacted. We're kind of rolling this out in phases there. Before handing over to Dr. Crowley, just letting you know that the beautiful thing and all of the clinical partners that the network have the same philosophy, that they believe first and foremost in the great care that physicians provide and the overall goal to improve that care for patients. It's not the financial interest, it's not the other secondary, product. It really is the end goal of the care that you're giving, making lives easier for doctors, having us work smarter, not harder, and again with the end result with that. Dr. Crowley, I think you have slides to share.
I do.
And with that, I will let Dr. Crowley introduce herself and tell us a little bit more about Guidehealth. And then we built in time for Q&A at the end. You may have already received the frequently asked questions list. That is a living document. So your good questions today and after this meeting will be added to that. So
Great.
Thank you, Dr. Crowley, and welcome.
Thank you. Thank you for having me. As Dr. Pagan said, so I'm McKay Crowley, VP of Clinical Operations at Guidehealth. I'm an internist by training and practice, had my own primary care practice for over 10 years, and recognize the incredible work that goes on every day, how it's really most times a labor of love. And that the requests and demands on primary care physicians continue to grow, even though there are still only 24 hours a day and 7 days in a week. I elected to join Guidehealth because the mission of the organization is to really help physicians and facilitate your ability to do more. And you've been asked to do more with less in the past, and we're hoping to give you not less but more in the services that we offer. And we look forward to working with all of you. So I will be able to more than happy to answer questions at any point. So Dr. Pagan, would you kindly watch for any hands?
I'm sorry, that broke up a little. Watch for what?
Any hands?
Okay, I will
Great.
look at that. Certainly, yeah, feel to use the chat function there. Under reactions, you can raise your hand too, and I will keep an eye on that while Dr. Crowley drives the bus.
Great. So our vision at Guidehealth is to make great healthcare affordable. And that's not just affordable for the patient, that's to afford physicians the time and energy to be able to continue to provide care. So as we shift to value-based care, there is a huge change in what's going on and what's being requested from practices all over the country. And most practices don't have extensive solutions put in place. And that was the kind of the impetus for PACN to partner with Guidehealth, is to help you with the resources that you need to make more and more of a transition to the value-based care arrangement that we're all being asked to transition to. So what does value-based care, what solution do we provide for value-based care? We bring a real depth of administrative services to function behind the scenes in terms of what risk-based contracts look like, how to help PACN and the individual practices through PACN manage them. We bring the technology that's going to be increasingly required for practices to be competitive and remain in business. And so that predictive analytic information about your patients is going to become more and more important to recognize the higher level of outcomes that are increasingly being demanded. And then we bring a care model that helps augment your existing staff, including health guides who are a CMA level staff that will be able to insert seamlessly into your practice to help you and help your staff manage these high risk, highly impactable patients that are really driving the care needs in our communities. So we have this health guide centric team where the health guide partners and becomes a part of the primary care practice. Your patient should know no difference between somebody who works there in the practice and our remote health guide, who is actually a human being. It's not a bot, it's not AI, it's not virtual from that perspective. It's a human being, and that health guide helps, again, as I said, guide these highly impactable patients, offloading your staff for a lot of the additional work that these patients require, but keeping you and your staff in the loop at all times, again, as if they were in your office. So these health guides will be conducting interviews of your patients. All of this is with your permission. They will be contacting patients with phone numbers that look like they come from your office, so that, again, the patient doesn't know, and we'll be coordinating with you to ensure that there's no overlap so patients aren't getting confused. That interview goes to one of our RN case managers. And then the RN case manager develops a care plan, and the care plan then comes back to the physician for approval, alteration. And then once that care plan has been approved, our health guide helps that patient navigate. So the things that would be included in the care plan would be things like, what are their social determinants of health? Do they need assistance with housing? Do they need assistance with having transportation set up, et cetera? So they'll help manage that for those patients. They'll ensure that those patients' care gaps get closed in terms of the quality star care gaps, et cetera, and then help those patients that require excess navigation around our very confusing healthcare system understand where and when they may need to be for specialty appointments, et cetera. All of this comes back through the EMR to the physician and staff. So the control remains in your hand. We don't take over the patients. We're not asking you to do anything different for the patients than what you're already doing. We're just adding an extra layer of care and care coordination around these patients. So the value to the primary care practice is that we help identify, although most of you, I'm sure, already know who most of your high-risk patients are. We do predictive analytics to identify those patients that may not have reached your clinical threshold for high risk yet, but I've worked with these algorithms and I can tell you as a physician, I was very skeptical about them until we started to really act on them. And they really are identifying these patients at important times. We develop high impact care plans. So as one of your physicians said earlier or later last week, we do not have goals that are things like patient will not fall. That's not a goal, that's a statement. And how that patient gets managed so that that event does not happen is really what the goal is of our high impact care plan. So does that patient have grab bars? Can we help arrange get that in? So when we say high impact care plans, we're talking about things that we as physicians know are going to help our patients live a higher quality life and not have unexpected interactions with the healthcare system. We'll help you with monitoring that patient status and provide that care coordination, where we will provide improved efficiency with office encounters. So you will no longer get a list of care gaps that need to be closed. We'll, on these cohort of patients, we'll let you know when that patient's coming in, and we'll also do that outreach to that patient from the list that we have of care gaps that need to be closed, and make sure that that care gap gets closed, or that patient gets scheduled with you for whatever needs to occur. And we provide we provide services that again assist in avoidable emergency visits and hospitalization prevention. And the value to the patient is, our goal is to strengthen their relationship with you, although you might think that most of these patients have the strongest possible relationship with you. We're just going to, again, wrap that additional level of care around so that they feel like it's coming from your office as well. They benefit from these personalized care plans. One of the algorithms that we've used demonstrated a prevention of index hospital admissions at the rate of 80% with a confidence interval of 95%. So the predictive analytics that we're using is pretty strong. I don't anticipate that all of them will be quite that strong, but those are the types of insights that we are potentially able to bring to your patient population. And then ensuring consistent preventive care, as well as meeting the network metrics for things that demonstrate shared savings. So where have we had pitfalls in the past? I think we all know that engaging patients and poor outreach has really resulted in suboptimal care, and that by using our engagement and predictive analytics and really coming to the patient as an extension of your practice with our embedded health guide will create significant improvement in that patient engagement and that patient experience. We also provide outpatient CDI or coding assistance. So most small practices don't have their own coder. It's a lot of effort and education to keep up with all the coding changes as CMS and the various bodies continue to move our piece of cheese around and make it harder and harder for us to be compliant with those things. We have an entire department that will help you with everything from pre-visit planning, which is scrubbing your charts prior to that patient coming in, identifying HCCs that are suspect or need to be readdressed, in addition to providing any education that you need on a more global basis around coding. We can also do pre-bill review, which is before that claim goes out the door. Does your documentation, is that reflected in your codes, and are your codes reflected in your documentation, so that we ensure completeness. We do all that behind the scenes, and all of these things that I've talked about go into the workflows that you already have. So we're not asking to come in and change any workflows. We really want to just add these supplemental staff, if you will, to your team. So more on the coding, we can provide all level of education sessions for you and your staff, and are happy to do that on a tailored basis. And that is the speed round of what Guidehealth is. And we certainly look forward to working with all of you in whatever tailored capacity you need us to assist in your practice.
Great. And while we're waiting for any questions that come in, either through chat or raise your hand, it's a lot. And that's one of the reasons that we picked Guidehealth, to partner with in this is because they had such robust depth and abilities to help us in this, almost as a one-stop shop. Now, I think it's very important to emphasize, and Dr. Crowley already said it, this is not meant to fix what's not broken. So if your practice is doing anything particularly well, if your practice is using your own care managers or other care managers, you know, if you have a chronic care nurse in your practice, that's fine. These are your resources. This is your team, and you should all be looking at this as an extension of your practice. Guidehealth has wonderfully, you know, agreed to be extensions of your office. They will not reach out to any patient without your, first of all, permission and direction, and with that, the expectation that you've spoken to the patient and said, listen, you know, we have some new resources. We're really worried about you. You have a lot of conditions. We want to make sure that, you know, you stay healthy. So and so will be reaching out to you, or we'll have somebody reaching out from your office. And it doesn't even have to be labeled with Guidehealth. It is your practice.
It should not be labeled with Guidehealth. This
It
is a
is your
white label
practice,
for
your
your
name.
practice. Yeah.
So this is a wonderful addition and supplement to your already strained staff to do this and to reach out and do this. And it may not have been mentioned before, you know, it's in the FAQs. There's no added cost to you. There's no added cost to your patient. There's no copays involved. There's nothing else involved. It is just you you know, identifying, and with our help, you know, because we have all kinds of analytics, and as does Guidehealth. They have a platform called Arcadia, which is pretty well known and respected too. Combined, we'll come up with patients that we think, you know, need that extra help and need that attention, and with you then formulate a plan and do that. So Janet from Peter McNeil's question asked, is the first step patient contact? Are you going to use a gap list? Or what if we have incorrect attribution there? So we're going to go by CMS data for the ACO patients first and foremost. That attribution, sometimes whether you like it or not, is almost in CMS's mind, it's never wrong. So if CMS is attributed to you, it's with you. And the introduction will be first to your practice, and then the mutual agreement on which patients to reach out and how to reach out with them. So, Dr. Crowley, I don't want to usurp your answer to the question, but I did want to emphasize, just to make sure that everybody knows, Guidehealth is a wonderfully robust product, but it is your product. Guidehealth is now part of your team. It's not a Guidehealth marquee, it's your practice.
Yeah, 100%. If your patients never hear the word Guidehealth, we're happy. That means we've done our jobs correctly. If your patients say, gosh, I really love the fact that you're able to do X, Y, and Z for me, because that's something that we're facilitating, again, we've been successful. So we will not contact patients before we've had permission. We'll provide you with a list of patients that we think are high risk, highly impactable patients. Additionally, once we're implemented in your practice, if you have a patient who's in your ACO population that you're like, they didn't make the list of highly impactable, but this patient needs your help. Those are the types of physician referrals and practice referrals that we love to have. So it's not just our list. It's not just the list that we come up with. If you have a patient that you know needs additional, we manage that.
Wendy has had certainly, and her team has been introduced to this too. Wendy, is there anything else we should be emphasizing or bringing out here?
I think you've hit it all here. The care management piece, as again, is huge. There could be other things, as you said, medication management, or things where the health guide will refer back to the nurse or back to the physician. But the care plans are developed, and then the physician is signs off on those. So if there's anything that the doc doesn't agree with, certainly, or has input or to change, that's something else that can be done.
And we have, our health guides are in a pod team with RN, case manager RNs. So there's a lot of medical expertise wrapped around all levels here, so that your practice is getting multiple layers of experience and service that we can bring to you.
One of the other things, I guess, to talk about, so with all of this information, and certainly with this connectivity to the EMR is going to be important. And I know that we've already established some connectivity in order to try to help you with the data and get an overall look, and also to help you with your reporting, not so much with the ACO, but some of the commercial contracts as well. So some of that connectivity will be shifting as well too. It should be seamless and behind the scenes as far as you're concerned.
Yeah.
I know we've been working with Healthy C with that connectivity. We're going to actually reroute the pathway so that the pathway of information is going to Guidehealth, and also to simplify the communication and the care management, to make sure that it in an easy way that doesn't involve a lot of steps for you. Also, those care plans being in the patient record and the EMR as well. So there are some logistic things that will be changing behind the scenes too. We hope that it's not going to be disruptive. Again, we do have meetings in progress to actually make sure, in fact, one of them later today, to make sure that the Guidehealth connection to your EMRs is smooth and seamless. But that's something that is fair to mention, and will be one of those things that, as it rolls out, needs to take place.
Right.
If there, again, feel free to reach out to any of your quality directors, reach out to me. If you have questions, again, we will be sequentially reaching out to all of the practices in the ACO at first to roll this out. So on an individual basis, you'll make contact with them. If you have interest in moving up on the list, if you haven't been contacted yet, but you're really eager to get plugged into Guidehealth sooner rather than later, let us know, and we do that. But a great question just came in from Ann Fisher. Are the contact with the patients done telephonically, or are there face-to-face or home visits by the health guides?
Yeah, these are all telephonic interactions.
Okay. But I think the health guides are going to be, at least in their knowledge, somehow community and geographically based. Is that right?
That is correct. Yeah, we are sourcing our health guides as locally to the practices as we can get them. The question came through about community resources. If we source people locally, they can pronounce the names. And some places in Pennsylvania, that can be a challenge. And so if they're not from there, they're not going to know what the community resources are or what the community looks like. So our health guides are sourced relatively locally. They may not live in your town, but they will live in a very close proximate regional area. Not out of state, and certainly not out of country.
Right. Well, I don't want to cut off communication. I don't see any other questions or that. We try to keep these meetings to a half hour during your lunch, knowing that you have so many other things going on. We're close to that half hour now. I think Donna or Wendy, if we could make sure that we save the chat, because those are good FAQs we can add to the list, or either save it as a file or copy and download it. We can do that. I don't want to prematurely end the meeting before you've done that. Again, more to come. You'll be hearing directly and individually from Dr. Crowley and the Guidehealth team along with us as we're rolling this out. And this is a great, again, this is a great opportunity that's going to kick us to the next level. And all that really needs to continue is the great care that you're giving all the time. There, we're blessed with a good network of good doctors who give great care. We just have to make sure that that great care continues, that you capture all aspects of your patient. Even the stuff that the specialists are doing to capture all of the diagnoses that the patient has and the complexity that the patient has, and of course to code that. And that's the other wonderful thing, is that Guidehealth has specific coding resources available for us, that any questions that come up, and certainly they will proactively make some suggestions as we're getting down to individual patients on what may be the best way to fully capture that patient, to make sure that their conditions are addressed going forward, and that everybody, including Medicare, understands that this patient deserves more services and will get more services. All right. Okay.
Thank you, Dr.
Crowley, you got the last word if you want.
No, I am very excited to work with all of you. You've been doing a fantastic, primary care is hard enough as it is. Many hands make light work, and we're really happy to serve you in any way that we can.
Great.
All right. Thanks.
Okay, everybody, have a great afternoon.